of bent toward, mainstream medicine. And
Yes.
I really got hit with that this week. I don't remember exactly how I got there or why, but uh, what came up was my 40/60 drops, my wet MD, my supplements, and there was a barrage of frightening information about what DMSO can do to the eye, especially with wet MD. And it was a little unsettling. It wasn't as easy to brush off as it usually is because of my
Yeah.
own very different perspective. And so I did want to run that all by you, and see, just be reassured because it does still sting. I mean, all the drops sting, and I don't mind. I can live with that because it's transient, and anything that doesn't last for more than a minute or two is or three or four is okay, is livable, is workable. So it's not that, it's the concern. It's not quite fear.
Okay. So let me ask you this. When you were talking to ChatGPT about DMSO in the eye, oh, hang on a second. I don't think you're hearing me.
I'm sorry, what is, I didn't hear the last part.
Can you hear me okay?
Yeah, I can now.
Okay. So when you're talking to ChatGPT, hang on, I'm sorry, I just got to turn the light on so that I don't look so washed out.
Oh,
Okay.
there you are. I thought
This is what I'm supposed to look like.
my vision had really gotten worse. I thought, she doesn't look the same.
No, your vision did not get worse, which is a bonus. But when you were talking about to ChatGPT about DMSO and eye health, were you talking about DMSO independently? Just DMSO?
No, I was talking about 40/60 and the combination of DMSO and uh,
Castor oil.
yeah, castor oil. And they seem to recognize that and said that is, very strong, and it was literally an assault, a barrage of information,
Right.
very scientific information about, why it's dangerous in the eye and yada yada.
Okay.
I can send it to you, but if you want, I still have it.
No, feel free. Um, don't think that I haven't gone round and round with ChatGPT and Claude. And the thing that I guess put both of those AI tools on their heels is me qualifying. I've been using DMSO and castor oil in my eyes for 3 years, and the strongest I've used is 50/50. And I no longer wear glasses to live my life, to use my computer or my phone or drive or anything like that. And then their whole attitude changed. It was, oh, that's amazing. That's wonderful. Well, most people that use DMSO in the eye, so most of the providers are using it like at a 2% or 3% you know, combination. And when I started really high with a 50/50, with 50% DMSO, 50% castor oil. Because I'd used DMSO and castor oil topically for pain. So I kind of knew what I should be looking for as far as feeling. When I dropped 50/50 in my eye, I was taken aback because that stung and it lasted for about 10 minutes. Um, but within an hour, my eyesight was so much better. I was like, I don't know, I might have to suffer with this. Um, and then it dawned on me, you could actually reduce it and see what works. And I started reducing it by 10%, and the 40/60 was cool, but it was still a little stingy. And this was way early on. This is 3 years ago. And I got the 30/70, and the 30/70 was totally doable. And, felt good in the eye. And I didn't have revitalize at the time. And I had dry eyes at the time. So 30/70 was doable. And using 30/70 for the first couple of weeks, my floaters were gone. And that was the catalyst that said, I'm so on to something here. It wasn't until I started talking to customers that I realized nobody's going to be able to use this long term, including me, without some kind of moisturizer in the eye. And then I started looking at over-the-counter eye drops and realized quickly those are kind of worthless, and decided to make my own blend with the Revitalized because I realized you need the eyes to hydrate. What's better than hyaluronic acid? And then you need a barrier, and that's where the vegetable glycerin comes in. And then you need to be able to thin that out so that you can actually drop it in the eye and have it absorb properly. And that's where the Celtic salt saline solution came in. So that's kind of the beginning story of where I came up with 30/70 and Revitalize. The 40/60 came along after using 30/70 and Revitalize for I think about 4.5 months in both eyes. So my right eye and my left eye. My left eye cataract was a severe cataract. So that bad boy just wasn't moving. You know, there's my daughter. There she is. Um, but it wasn't moving like the right one. So in 3 months, my right eye was clear of the cataract. So the haze, that white constant haze that was there was gone, and clarity had come back to that eye. So being able to see street signs and license plates and um, uh, traffic lights and the number of things I could see was dramatic in my right eye. But my left eye was still, back at I'm full of cataract. And that's where I started developing for an eye, because in paying attention to what's going on in the eye and asking all the many, many myriad of questions. I honestly wish I had all the questions that I asked somewhere, but it would be a book nobody would ever read. Because I mean, I went on for days asking questions about what's actually happening in the lens of the eye, and why does the lens of the eye, catch this buildup, and where does the buildup come from? Where's this protein? Is it constantly there and it's being washed away on a regular basis? So all of those questions came up, but that's when I developed for an eye, because all of those questions informed me that DMSO and castor oil are not necessarily going to do enough in every case. And when you have a severe buildup of protein on the lens, castor oil and DMSO can get there and they can get in there, but breaking apart that what is almost like concrete on the lens of the eye is going to be a long-term process if you're just using castor oil and DMSO. And I found that Meliopanini honey, combined with DMSO, actually softens that cataract buildup. And that softening is what I needed. And it took probably 3 or 4 months to figure out the recipe for foreign eye, and then another 4 months of using it. And then that cleared that cataract. And in that process, I was also, you know, providing product and getting information, getting feedback from different customers with what their issues were and what their results were using various products. And that's where I've come up with these, the list of products based on the symptomology that you're experiencing and how to use them. Is these 3 years of other people using them and giving me feedback, and that feedback is informing me of what the next step is.
Okay, but you haven't mentioned MD or wet MD, which is what that barrage of scary information was about.
Right,
It was about my right eye. Well, my left eye is they both have dense cataracts, especially the left eye, really, really dense. The left eye also has dry AMD, and
right,
the right eye has wet. So
right,
there, and I remember when I saw Amanda Vollmer's 3 hour webinar, she was recommending 40/60. You know, her drops are with, I think, distilled water, but they're also 40/60 um,
right.
for cataracts, but 30/70 for MD. And I wasn't sure, I suppose I could do different ones in different eyes. But that's that. And then I asked you if it was okay to use 40, and you said it was, even
Yeah,
though I was having the stinging. So I just want you to address that part of it, the MD part of it, and the danger or lack thereof of scarring, bleeding, all the things that they were warning me about.
yeah. I haven't had anybody have any experience where DMSO and castor oil left scarring. I've had many people have the experience of the removal of scar tissue, and that verified by their doctors. Like I would not know if scar tissue was no longer there. I do have multiple customers with wet AMD who were um, using injections to try and manage it that are no longer getting injections, and their doctors have said your wet AMD is way better. I've had multiple customers with different levels of inflammation in the eye, from uveitis, to retinitis, the corneal swelling that has completely been alleviated. And I don't know if Altamise is on here. Altamise, are you on the call yet? I don't think so.
No, I don't see her on right now.
Okay. But Altamise had I don't remember exactly what it was, what edema she had. I don't know if it was macular edema or retinal edema, but after using 40/60, she went back to her eye doctor and he's like, the edema is completely gone. And her eyes were very, very healthy. So I can share with you, um, different customer reviews and comments from my lives, because I don't solicit, uh, people giving me reviews of what's happening. I want people to tell me honestly what their experience is and what's going on. Um, I had another gentleman, he's in not Utah, Nebraska. And his eyesight was, getting really bad, and he was on the edge of multiple surgeries. He started the product, and within 3 weeks, his eyesight and eye health got significantly better. I don't remember if macular degeneration was what he was dealing with. I do know he was seeing a retinal specialist. Um, but he commented that the drops got him fixed. There's no qualification that I can give you that's going to make what ChatGPT says make a ton of sense, just because ChatGPT predominantly uses standard medical information to compare and contrast against. And that's not going to be reasonable with, DMSO and castor oil. Did I lose Enid? I think I did. I think I did. I
Yeah,
think I lost
yeah,
Enid.
it dropped off.
Okay.
Hopefully she'll come back in.
Yes. All right. Everybody unmute so you can talk at will. Jana, how are you doing tonight?
Wait,
All
am
right.
am I unmuted?
You are unmuted. Thank you
Yep.
very much.
Oh, I was interested in that conversation. Uh yeah, it sounded so much like a conventional agenda of fear-based information. I can understand how there would be concern in hearing all of that. I certainly do,
So do I.
but I do also get the agenda of that platform, I guess. Uh, and underneath that is usually greed and narrow thinking. But yeah, I mean, yeah,
Well, and you have to add to it when you're talking to ChatGPT, you have to add to it that you want information that's directly associated to the use of DMSO in the eye, not the standard cautionary information.
right. Well,
So,
I don't use Chat GTP. I just don't. Part of it's just maybe my generation, but I don't. And I even, Google is even suspect to me in looking up information. But um, yeah, I mean, for some reason, I'm hearing a background here.
hang
But
on. I wonder if it's, hang on. Let me see if it's, no, somebody
but
has their, like a YouTube page open.
I see. Yeah, I don't. But yeah, I'm still using everything and I don't know if anyone else on the call has experienced the new revitalized sting, but we can call it that, the new revitalized sting. But it is really intense with that new product. Well, it's not a new product, but your new distributor.
Newly blended. Yeah, the
Yeah.
new
Um, but I
hyaluronic acid.
yeah, I'm still waiting for. Like I said yesterday, waiting for the floaters to go because they're still there. I haven't been to the eye doctor to see what they say about the beginnings of cataract. They've been telling me now about years. One of these days I will go. I'm kind of waiting for maybe the floaters to go away and then go get an exam to find out what's going on. The progress report.
Right.
Um, but yeah, anyway, I'm I'm still using the products, still trust them, and uh, yeah, the day the floaters will go away will be a celebratory day for sure.
Yeah, no, we're gonna break out, the Macy's Day parade balloons with that
Yeah,
bag.
and I don't know why they're so stubborn. Yours went away right away, and the DMSO castor oil. So I'm not sure. But again, still haven't eye gazed. I still haven't sun gazed, and but yeah, that's about the only thing I'm not doing.
Good evening, Leslie. Are you
Hey,
hearing
how
me?
you doing?
I don't know what I'm doing. I just I don't know what I do to be on this Zoom because I don't know how to use it. But are you hearing me?
Yeah, I can hear you just fine. Can you check and see if you have YouTube open?
I don't know what to do because I cannot see. I don't know what to do. If you
All
tell
right.
me, then I'll do it. If you
No,
tell me,
no
then I'll.
problem. No problem. Hang on. I'm gonna see if I can figure it out.
Oh, okay, I'll let you go. But
No, you're good, Jana. Hang on just a second. Okay. So, Anne, I muted you because I think you've got a YouTube page open. As soon as I muted you, that echo stopped.
yeah, it stopped.
So I
So
think you've got a
so
YouTube page
it wasn't
open.
me. So it wasn't me then.
Say that again.
So it wasn't Joan Sterling. Have a YouTube page on.
No, you're fine. You're fine. Not you. It was somebody else on the call.
Excuse me, Leslie. I don't know what to do.
No,
I don't
you're
know what.
fine. You're fine. You're doing perfect. You're doing perfect. You're exactly where you're supposed to be. I can hear you just fine. Can you hear me okay?
I hear you okay, but I don't know what to turn off or what to turn on.
You don't need to turn anything on. You're good.
Okay, thank you very much. It's my first time.
Stop trying to be better than perfect. You're perfect.
It's the first time first time I am on Zoom.
Yes, and you did great. So you're perfect. I can hear you. You can hear me. That's the 100% of what we're doing here.
Okay, no problem. What I want to talk to you about? Are you hearing me?
Yeah, I can hear you. Can you hang on just a minute? Because I want to finish this conversation I was having with Enid
Okay, no
before she
problem.
got disconnected.
Oh,
Just tell me when you're
sorry.
ready for me.
Say
No
that again.
problem.
I'm
Okay.
so
Just
sorry. My screen just went black. Anyway, I really am sorry. I was out of juice or something.
Yeah, no reason to apologize.
Okay, thank you.
No, you're more than welcome. Altamise just joined, and so I want to have Altamise discuss her experience. Altamise, unmute yourself.
okay.
Can you hear me now?
Yes, I can hear you.
Oh, I've been trying to find the link on the website and I couldn't find it.
It should be up there. There's a rotating banner now, and it said one of them says, free shipping between June
Yeah, I
1st and
saw
June
free
4th.
shipping.
And then it should rotate every 5 seconds to the link to be able to
Oh,
come to this.
okay. Anyway, I had to try to find another link on my phone and I sure can't see anything on it. How are you doing?
Fabulous. How are you?
Good, good, good.
So listen, I want you to tell the story because we've got Enid on the call, and Enid has been chatting with ChatGPT about DMSO in the eyes, and ChatGPT got her a little concerned, which I can understand. And everybody forgive me for chewing, but I haven't eaten anything all day.
Don't
And
choke,
my daughter just brought me some nuts.
but don't choke. Don't talk while you're eating.
I know. So
Well,
ultimately, I wanted you to talk about because Enid is dealing with dry macular degeneration and wet macular degeneration in one in each eye. And I wanted you to talk about when you went to the doctor and the doctor said all the edema is now gone and
oh,
everything's looking really good, and what products you were using when you went through that occurrence.
okay. Well, I had my appointment and he told me I had severe inflammation. And at this point, my left eye was hurting a bit. So I stopped doing anything before I went to his office. And then after he said I had severe inflammation, I came back and relayed that to Leslie. So she said, we'll just do the 40/60. So I was doing the Revitalize and 40/60. He had given me a prednisone prescription for the inflammation, and I didn't take that. So for 2 weeks, on alternate days, I believe it was, I did the Revital Eyes and the 4060. Okay. And once I returned to his office, all the inflammation was gone. He said there was no inflammation. I said, none. I said, you see nothing? He said, nothing. There's nothing there. So it was gone, and it was just the 4060.
And was
So
that, did he identify, was it just inflammation or was it related to macular degeneration or other diagnoses, cataracts or anything else, or is it just usually inflammation is part of those diseases, I think. I'm really not sure.
he had never mentioned to me inflammation before. And I think I had gotten some kind of irritation from trying to use the foreign eye. I was gung ho and I was getting a little sting and then a little sting, and I refused to stop. So I just kept on doing it. And then I told Leslie I felt something, in the eye. And when I went to the doctor, that's what he said. It was severe inflammation. Um, I'm dealing with retinopathy.
Oh, I see.
From the beginning, I had a little swelling in the macular, but after I started the products, there's no sign of anything going on there. The back of my eye was clear and no red spots that was indication of inflammation or anything. Everything was clean like it needed to look.
Right.
But the thing is, I have a little bleeding behind the eye from the retinopathy. So that's what I'm trying to work on.
I see. Well, thank you, Altamise. Sorry.
I don't know
No,
if
no,
that
no.
was good enough, Leslie, but
Yeah, no, and that's the whole point is you're telling your experience, and I can't ask for anything more than that. I don't want anybody to feel like uh they're getting information that is targeted,
oh,
to make
okay.
you make a choice. Like it's all, this is your experience, and your experience is valuable because it's your experience.
Okay, well, let me tell you what happened last night. Of course, as soon as I hung up the phone, as soon as you went off, um,
You
I
found your
found
dropper.
my droppers. It was where I was looking all along. I just couldn't see them. So anyway, I did the left eye, um,
For an eye.
and that
Good.
was a little sting. It wasn't bad. And I
Okay.
was surprised. I was waiting on more, but there was no more. And I didn't notice anything any different or anything from
Okay.
that last night. So this morning, I did the other eye, and it was less stingy than the left eye,
Okay.
and I saw no difference really. So later on this afternoon, I did them both again with the
Okay.
Revital Eyes, the I2, and I follow up with the 4060. So I did that once today. I didn't want to, you know, irritate anything, so I just kind
Right.
of left it at that. So I don't know what I'm going to do next. My
So
appointment is
I don't want you to use the 4060 yet. I just want you to use the
okay,
402, and I want to increase it as opposed to add 4060 to it. I want to increase the use of 4 and I2 to 3 times a day, but I want to walk it slowly so that
right.
you really understand how it's affecting the eye. The eye that you have with like that blood pocket that you still
That's
can
the
see,
left.
the left eye,
Mm-hmm.
that's the one that I'm most interested in, how foreign eye 2 affects that eye.
Right. Okay, and that's what I would. That's why I did it first to see if I noticed anything overnight.
Okay.
And
And
I
one drop ain't gonna get you there. I mean, and it's good to check, but one drop is not gonna get enough going that you're gonna notice anything significant.
I meant even with the feel of my eye.
Oh, okay. Yeah, no, that's perfect. So you didn't like wake up and feel anything significant, or you didn't feel anything like debris in the eye or any kind of itchiness or scratchy feeling.
I didn't last night, but
Okay.
today when I used it this afternoon when I did both the eyes, I did feel the what did you say? How did you describe it? It was like a scratchy kind of thing.
Yeah, scratchy or debris in the eye, like there's
Yeah, that's what
something,
it
a foreign
felt
object.
like. It felt like debris, and I'm thinking it's something that was in the eye drop maybe. Is that the one you said has what ingredient in it that might feel that way?
Well, that's not the eye drop that I actually said that about. So
Okay,
the
okay,
foreign eye
okay,
two, yeah, is the hyaluronic acid, the Maliopanini honey, um, Celtic salt saline solution, um, and castor oil.
okay.
So
But
that
mine
shouldn't
doesn't
have,
have castor oil though, does it?
no, it doesn't have DMSO.
DMSO. Okay, right. Okay,
Right. It has
okay.
castor oil, no DMSO.
Yeah, I'm confused. Okay,
So yeah, the macular regeneration is the one that has the uh, lecithin that can leave a feeling of debris in the eye for just a
right,
couple seconds.
right. That's the one. So I don't know. I've been trying to feel if I feel anything different. But they feel kind of both the same. And I've
Good.
been touching my eyeball through, the lid.
Yeah.
And this left eye, I just think there's something going on with it. And it could just be that fluid there when I feel it because it feels a little different.
So looking at your eyes, and I'm happy to actually be looking at your eyes. Um, the top eyelid does look like there's inflammation.
You can see my eyes.
Yeah, your camera's on.
I sure didn't mean to have it on.
Why?
Mm.
Why not? We got to spread the beauty around. You can't just leave it all to me.
Oh, that was an accident. Yeah, but you can't see it. Does it look puffy?
It does look so your left eye looks a lot more puffy. Um, like at the crease, when you open your eyelids, at the crease that is the upper part of the eyelid, it
Uh-huh.
looks puffier than the right.
Okay.
So that's me looking at your face. So, and I can't, guarantee that that's not normal. I don't know because you don't normally have your camera on, so I can't,
Okay, well, I
judge.
asked my husband when he comes back. I think since different things have been going on with my eye, they just don't look the same to me. And of course, even when I'm looking in the mirror, I cannot see,
Right.
what they really look like. So,
So,
um,
but if you like if you put your fingertips on your
mhm.
eyelashes, right?
Uh-huh.
And then what I want you to do is just slowly crawl your fingers up to your eyebrow and then brush back down. Do both your eyes to you feel like they're, got the same amount of fluid, they're the same density, they feel like they're the same when you do that.
No, my left eye feels different.
So it feels more, it feels bigger, like there's more fluid in it.
It feels not like it's bigger, but it feels like when I go across my left eye that I'm affecting something behind it. So that's why I'm saying it just felt like maybe I'm my eyeball is pressing against the fluid once I press on it a little. Does that make sense?
Well, I can only see fluid in the front of your eye. I can't see fluid behind your eye.
Right, but I'm saying that's how I feel when I
So
press it.
when
My
you
eye,
press on that left eye, you feel like there's fluid behind the eye.
yeah, feel like, yeah, something is a little bit sensitive.
But you don't feel anything in the eyelid, in the upper eyelid.
No, no, no.
Okay.
Yeah, it
And
look
it
like
could
I
just
feel a
be,
little, looks like I feel a little vein or something there.
well, there's veins. That's
Mm.
not abnormal.
But no, I don't feel the front puffy.
Okay. So when your husband comes back, have him look at your face because he's got a
Mm-hmm.
different vantage point, and just ask him if one eye looks like it might be a little more inflamed at the top of the eyelid.
Okay, do you see where my finger is here?
No, I can't see that far down. So I'm just seeing like right at the end of your eye and up to your forehead.
Can you see now where my
I can
finger
see
is
I
on
can
my
see your
eye?
left eye. I can see it now, yes.
Okay. Does that look puffy right there to you?
No, that
Uh,
eye looks pretty good. So maybe I'm talking about your right eye.
you are
It's
talking about my right eye
opposite. I
then.
am talking about
Okay.
your right eye.
Okay. All
Yeah.
right. Okay. So then tomorrow I just do the revitalize and the I too.
And the foreign eye too. Yes.
Okay.
Yes.
Okay.
And do it twice in the day. And then so tomorrow's Thursday. So then Friday, we're gonna go up to 3 times a day if twice a day works really well.
Okay. All right. I'm just, well, I said that so many times. I don't know why, but I get the feeling that nothing's, and I don't want to put a negative out there, but it's not going to do anything until that gets from behind my eye, the
And
fluid.
that's why I'm wondering if the Maliopanini honey has the ability to, break up whatever's happening at the back of the eye.
Oh, okay. You think there may be a possibility?
Yes.
Okay. Okay.
Yeah. But I
I
want to
was
make
trying to
sure.
see. I was trying to see if there was a difference. So the entire time that buildup is behind my left eye, it's almost as though I have a patch covering the left part of my left eye,
Right.
and I haven't noticed any significant change there. So I'll keep an eye on that. 2 times
Okay.
tomorrow.
Yes. And then 3 times on tomorrow's Thursday, right? Yeah.
Right.
So
Hmm.
and then 3 times on Friday. But I will talk tomorrow at, you'll do it
Hmm.
twice. We'll talk about it and see if you had any adverse, feeling
Okay.
reaction, anything like that.
Okay. I'm just so hopeful. I'm just praying. I'm ready for something to move.
I know it. I know
Yeah.
it. So we just gotta figure it out. It's just, one of those things. It's like an algebra problem you've never seen before. You just gotta figure it out.
Okay. One other thing. Um, Without the DMSO, this moves slower.
So it doesn't get as deep in the eye without the
Mm-hmm.
DMSO, but because you
Mm-hmm.
have the 4060, when we combine them, you will get the 4060 will pull it further in.
Okay. Okay. Good.
Okay.
All right.
All right.
Thank you.
You're welcome.
Well,
Okay. Enid, go ahead.
well, I'm wondering what you think I should do. You mentioned for an eye for yourself when you were, and I wonder if that's something that I need, or should I just stay with my protocol, which is tw revitalize twice, 2 drops in each eye, 40-60, and then see clear?
Yeah, I want you to stick with that protocol until we have evidence that we need something different.
Okay, and 3 times a day?
Yes.
Okay, and I received a second package of, I'm assuming it's the same thing that I got the first time, but I only ordered one of each and then I got another package. Was that a mistake?
Yeah, on our part. So enjoy the free product.
Okay, thank you.
You're welcome.
And and if you would just indulge me for like 4 minutes, I would just like to, I found it was not ChatGPT, it was Gemini, you know,
Okay.
I would just like to read 3 very short paragraphs,
Sure.
get your response to them. It's titled The Problem with 40-60 DMSO Eye Drops. And the first one is extreme chemical concentration. A 40% concentration of dimethyl sulfoxide is exceptionally high for direct application to the ocular surface. DMSO is a powerful industrial solvent and chemical penetration enhancer. 2, the cataract risk. In ophthalmologic animal safety, sorry, 1 second. Oh God, it just went away. So sorry. There we go.
No worries.
In ophthalmologic animal safety studies, repetitive high-dose administration of DMSO to the eye has been explicitly shown to induce or accelerate cataract formation because you already suffer from dense cataracts. Utilizing an unapproved, I hate that word, highly concentrated solvent directly on the eye may fundamentally work against you by aggressively worsening the density of those cataracts. 3, this is the final one, corneal and surface damage. At 40%, DMSO causes severe burning, localized cell damage, and chemical irritation. While it is praised in cellular medicine as a transport molecule, the human cornea is not built to withstand this concentration without risking structural scarring or superficial chemical burns.
Okay. All of that is, in a word, horseshit.
Okay,
First of all, to say that DMSO is a chemical solvent, this is true, but so is water. So, and a solvent is just anything that's used in the manufacturing of a good. So, a lot of manufacturing uses water, and water is considered a solvent. So, that is said to push you away from the idea of DMSO.
right.
Secondly, I would ask, what evidence is there that 40% DMSO is too strong for the eye, the surface of the eye, the back of the eye, anywhere in the eye, for the total eye system? What evidence are you basing that on?
Well, that particular paragraph doesn't mention evidence, but
Right.
other ones do. The one about,
Okay.
so,
And I've looked at all of the evidentiary information about DMSO and ocular use. And the thing that I learned is there aren't any significant studies with DMSO in the eye. All of that information is predominantly anecdotal, and they're just assessing because what DMSO is, and you don't obviously want to use it in an environment where it's dragging non-specific things deeper into the eye system. So you wouldn't want to like use DMSO with tap water because you don't know what you're bringing deeper into the eye. And DMSO penetrates so deeply, it drags whatever is connected to it with it. You have to be cautious and careful. And the, Gemini is just telling you from the standpoint of the most cautious thought process. Here's what we know to be true. I don't believe that DMSO enhances the buildup of the protein material that is a cataract. If that was true, I myself would have the biggest cataracts known to man.
True.
I would. Because I use it in my eyes every day, and I have for 3 years. So if it actually caused cataract buildup, I'd have the worst cataracts anybody on earth could have.
You'd be blind.
Well, virtually, yes. So I disagree with the affect of the statements. It's not that they're untrue, but they aren't based on anything that's real.
How do you feel about that third statement, which mentions the burning and the scarring and I don't think there's any specific evidence there either. Let me look. I don't remember.
Well, and the stinging, I don't believe there is a burning. I believe there is a stinging. There is not a burn because it doesn't leave a scar. If, just like cayenne pepper, when you eat cayenne pepper, it can be as hot as the day is long, but it does not damage, you know, your mouth. It doesn't damage the skin. It burns, but it doesn't do damage.
Right. No, it was referring to real damage, but it didn't really mention any evidence about it. And the thing that I always remember, as a result of watching Amanda Vollmer's 3-hour webinar on healing the eye with DMSO, is that she kept saying DMSO does not harm.
Right. Right. If you put 100% DMSO on your skin can tolerate it if it has air and the whole 9 yards. If you actually have um, damage on the skin, so if you have dermatitis or something like that, it can actually cause that to inflame and be a little worse because of the lack of moisture. But it's not going to create this, massive harm that didn't exist already.
Okay. Thank you, Leslie. I really just needed to hear you say all of that. I really
Yeah,
did.
no worries. And I'm going to tell you, if you take, like, your mouth is a very vulnerable place, right?
Especially now after the
Well,
surgery.
but if you were to take your finger, wash your hands, put a drop of 40/60 on your finger, and then rub that around the area where you've had that surgery, and then set a timer to see how long it takes to have no pain.
Okay.
And then look at that area an hour later and see if you see damage.
And when you say to see if I feel no pain when I'm feeling some soreness, is that what you mean?
Yeah,
The soreness would go away if I did that.
yes, absolutely.
Yeah, I wish they had prescribed something like that instead of, I really do. I think, well, if it's a holistic practice, why are you giving me amoxicillin and ibuprofen? Why
Yeah,
don't you?
100%, 100%. And both DMSO and castor oil are antibacterial and antifungal.
Right. Well, okay,
So
I'm gonna try that. I am. Thank you.
no problem. And if you wanted to, you could take the dropper and just add a squirt to some distilled water and then just rinse your mouth with it just rinse it out and then see how you feel 10 minutes later.
Okay.
So
Let's
I don't agree at all that DMSO is damaging in the eye in any way, shape, or form, unless you're using DMSO at 100% strength, which nobody is.
No. Okay, great. Thank you.
Okay, you're welcome. Altamise, you had a question?
I was going to ask, did I hear her when she was reading say something about damaging the cornea?
Yes,
Yeah.
you did.
Yeah, because the cornea is, a very particular piece of the eye. It's not that thick, it's thin and it's right on the surface of the eye. And if anything is going to do damage to the eye, it's going to damage the cornea first.
You know what my doctor said mine looks unhappy?
Yes.
I'm thinking when I first tried the foreign eye, and
Hmm.
I told you I was putting it directly on the eyeball,
Yeah.
and it was really, really, you know,
Stinging.
past. Yeah. I'm wondering if something happened that by me continuously putting it on that same spot, because I thought that was the correct place.
Well, I
It
doubt
would.
it very, very seriously. Even if you're dropping it directly on the cornea, because that particular blend is only 20% DMSO, number one, and it has a lot of other ingredients that are protective in the eye system and protective of the cornea.
Okay.
So I think if it were to be damaging, it would be damaging from the very first drop. Like you would not be able to do it again and again and again.
Where I almost was not able to, but I just did it
I
anyway.
mean, I'm telling you, you would not have been able to do it twice. Like
Okay.
it would have caused that much damage, pain in the eye, and you'd been able to see how disrupted the cornea actually was. And your doctor said the cornea looks unhappy. And you said,
Mm,
well, what's going on? What do you see that looks like, I don't really know. I can't tell you, but it just looks unhappy.
right. Yeah.
So,
He just thinks it's something going on. Fuchs, he just couldn't say. Yeah. Yeah.
right.
Because it wasn't his specialty. Yeah.
Yeah, that's like you telling somebody, you look too thin. Well, what does that mean? I don't know, but you just look too thin. Well, the truth is you can't be too thin or too rich. So what do you mean by I look too thin?
Mm-hmm.
And if you can't describe it, then you don't know enough about the thing you're talking about.
So you shouldn't even said anything. You should have just told me.
Exactly.
You should have just recommended I go further.
Yes, exactly.
Mm-hmm. Yeah.
Exactly. Because at least if you're going to say I need you to see another doctor, the reason why is because
Right.
XYZ. There's
Right.
inflammation, there's dryness, there's it's misshaped. It looks like you
Mm-hmm.
might have keratoconus. I think I see a growth. Maybe there's a tegerium growing there. Like whatever, there's something going on that you can
Mm-hmm.
literally tell is here's why I want you to go see somebody with advanced knowledge.
Mm-hmm. But another thing that gets me, why is the one eye different than the other eye? That's another thing that bothers me. I don't get it.
Well, that's like asking why one foot's a little bigger than the other.
No.
It is.
No, I'm just laughing. I
Well,
know it's absurd. I know what you're saying.
yeah, yeah, because it is. That's just all there is to it. Because it is.
Yeah.
So we just gotta live with it and deal with it.
When I
So
say no, I just mean, okay, what a simple answer, but so true. That's all I'm saying.
okay. Yes, our
like,
bodies
like,
our bodies don't have asymmetry. One side
yeah,
is not the exact replica of the other side.
yeah, that's like, yeah, okay, dummy.
No, not at all. Not at all.
Oh,
So, all right, let me move on to some other people. Anne, do you want to unmute yourself? And then Jean, if you want to unmute yourself.
Oh, okay, I'm unmuted.
All right, Ann Catan, how are you doing?
I'm doing all right. I just found out I had macular degeneration in both eyes, but do you know what a hemangioma is?
I do not.
Oh, well, it's a growth, kind of like a little tumor. I have that behind my eyes. It's not cancer or anything. It can be anywhere in the body. I just happen to have it behind the eye. And so I have that on the one eye, and it's obstructing my vision. Some doctors said I might have been born with it, but between that and the macular degeneration, I'm like getting nervous, like what's going to happen. So I had read that the DMSO in the eyes was good, but then I'm a little bit afraid to use it.
So hemangioma is a benign, non-cancerous collection of abnormal blood vessels. They can
I don't know if
occur.
it's blood vessels. It's like a more like a tumor. It could be anywhere on your body. I also have a little one on like my ankle. Like it can be
Yeah.
anywhere, but this one is like in a bad spot. I don't know that it's blood vessels. Like when I
Well,
get
I'm
those.
just telling, I'm reading ChatGPT and this is what it, or not ChatGPT,
Oh,
Claude
that's what it
actually.
says.
Yeah, but that's what it's saying. And it says they can occur in or around the eye in several different locations, and the symptoms and treatment depend on where they are. So capillary hemangioma, so eyelid or orbit, most common in infants and young children, may appear as a red or purple strawberry mark, can interfere with vision if it occurs or if it covers the pupil or causes astigmatism. And then there's
Yeah.
choroidal hemangioma, and that's located beneath the retina in the layer called the choroid, usually diagnosed in adults. The symptoms may include blurred vision, distorted vision, reduced central vision, a gray or dark spot in the vision if fluid develops under the retina. And then there's retinal cavernous hemangioma, a rare cluster of blood vessels within the retina, often causes no symptoms and is found during a routine eye exam. Occasionally may bleed and affect vision. And then there's an orbital hemangioma. It develops behind the eye. This sounds like what you have. In the orbit, can cause bulging of the eye, double vision, blurred vision, or pressure or discomfort.
I have sometimes a little pressure or discomfort, and I have like blurred vision, but and just the blurred, yeah, I had the blurred vision for a long time. They say there's nothing they can do, but now I just went to a different retina specialist, and he said it was leaking a little bit, and then he told me about the macular degeneration. So, and I
Okay.
don't, even with the correction, it's okay, but it's not good even with the glasses. But I don't want this macular degeneration to get any worse either because, like looking for things to do to like try to like stop this thing.
So, for for the hemangioma, how bad is your AMD?
I'm not really sure. He didn't really say. Um, I mean, I didn't have any symptoms. I was like shocked when he said it,
Okay.
and
And is it
because,
dry AMD?
yeah, dry.
Okay. I would recommend for you from my, arsenal of products, I'd recommend the 3070 and the
Hmm.
C Clear with DMSO. So the Revitalize 3070 and C Clear with DMSO. And then let's see how things go for the first 3 or 4 weeks. And then have you go back to the doctor and have them look again and see what they see.
So how many times do I do each of these?
So you're going to start with 4 times a day, and it's twice in an hour. So you do the drops once, wait 30 minutes, do them again. And then you wait however long till you're ready, to end the day. And you're going to repeat that one drop 30 minutes later, we're going to do it again.
1 drop. All right,
Well,
so,
one drop of each product.
all right, so by 30/70 and C Clear.
Yes. And
Okay,
the
I have to,
Revitalize comes with the 30/70. So that's, you don't purchase that separately.
oh yeah, I saw you had the combo, and then the C Clear. All right, because how long will it take to get here?
Where are you located?
Florida.
Oh, okay. So it's 1 day shipping, and it'll take maybe 3 or 4 days to actually fill your order, depending on when you make it.
So like roughly a week. Okay. All right,
Correct.
that's good. Okay. And then, all right, 4 times a day, put um, 2 times in one eye in an hour, one drop in 30, one drop and then 30 minutes later, one drop. I got that.
Correct.
Okay. And then do both of them like that?
You're going to do both eyes, yes.
No, I mean, both See Clear and Revitalize?
Yeah, all 3 drops.
All three, 4 times a day.
Correct. Four
Okay.
four doses a day. And yeah, twice in an hour morning, twice in an hour in the evening.
And then how long do I wait between each drop? Like I know, like do the one, like Revitalize, then do the other one, and then wait like an hour, and then do the See Clear.
No, you're not going to wait an hour. You're just going to wait till your eye normalizes. Just wait till you can, blink your eyes and open your eyes and look around. Okay, next drop.
Oh, okay. Okay, I got it. Okay, that's great. Okay. Okay, thanks.
No, you're welcome. You're welcome. You're welcome. Jean, how are you doing?
Hey, I'm hanging in there. How are you doing, my
Excellent,
eye
excellent, excellent.
queen?
How have you been?
Oh, ups and downs, ups and downs, ups and downs. But I'm hanging in there,
That's
fighting
all
a
we
good
need.
fight,
That's all we need. Keep hanging in. Keep hanging in.
fighting a good fight. I tell you, every doctor I get want to battle with me. They keep losing. You
Well,
know,
you got to be, when right's on your side, they can't win.
Ah, I tell you, But this today I went for because I go every 6 months to the ophthalmologist to get my eyes checked and everything because of the cataract situation I have. Now today, interesting. But first, let me go back a little bit. I've been doing the product since last March off and on to around June. Then I got real aggressive. There's somewhere along the line. Remember, if you remember, I had to change my glasses and drop down because I was
Yes.
seeing better. Okay. Today, with my 6 month checkup, my eye pressure has been remaining around 16, 17. It was in the 20s in the beginning of this
Okay.
in December of 2024. And then once I started the products in 2025, the numbers started moving down. So I've been hovering around 16 in one eye, 17 in the other. I guess for about 6 months or so,
Okay.
roughly. So the day when I went there, I always have to tell him when he does things. I got a copy of the report today of the visit, and I tell
Okay.
him don't write things down that you haven't discussed with me, because when I read it, I get a little pissed. Now he did say that I'm losing vision in my right eye. I've gone from 6 months ago. It was September rather. It was 20 in the right eye, 20/25. Now it's 20/40 in that
Okay.
right eye, which I have noticed some changes in that eye, but I wasn't sure what it was. And I am using the Latanapro sparingly because I was consistently using the 30/70 and Revitalized twice a day. Then I have both C clears that I use throughout the middle of the day or like
Right.
that. So now he's saying that trying to talk surgery. I said no, no, we're not going to talk about that right now. He had
So just
wrote on
because
the
your eyesight changed from 2025 to 2040, he wanted to do surgery?
Yeah, because I have he said it's caused by the cataract progression is why that happened.
Okay.
And his assessment was the patient presents with poor signal strength on the opt disc and a GPA cannot be calculated. Now, I had a problem today when the testing was done that he does by his staff.
Yeah.
Because I felt like something wasn't, because she did it twice, same test twice, but she couldn't get my eye, whenever they do with that machine, when they put those lights on your eye, she said my pupils were small. So
Okay.
she put the stuff in my eye, which I hate that stuff. And then she took me back into the room to do the test again.
Right. To dilate
Well,
the eye so they could
well,
then.
check this out. My eyes, you know how you get all the fuzz and cloud when they
Yeah.
dilate you? My eyes did not dilate until 10 or 15 minutes after I walked out of the second test, and I was sitting, waiting. All of a sudden, the whole room went smoky.
Okay.
So how could you get a clear
A clear
test
reading if your eyes weren't
if my
dilated.
eyes was 15 minutes out of the test that the dilation took place?
Yeah.
I was real angry because I didn't want to question her credentials like that. I didn't want to embarrass her like that. Do you know what you're doing? No, she did the second test for the, when they checked the pressure, she had to go get somebody in to help her get the thing going, whatever, with the light and all that. But anyway, I don't know if these notes are really proper. I'm not sure. But
What
also,
was it? What was the pressure in your eye? In your
one
eyes?
was 16, 17 in the right and 16 in the left.
Okay. So your
That's,
pressure's normal and staying in that range.
yes, it's been staying
It's
in
very
that
stable.
range for months now. It's
Okay.
been, and like that. Because remember, I originally started out 24 and 23, and
Right.
yeah, like that. Now he says, also her vision fields present with GHT, general reduction of sensitivity. This all appears to be due to cataract progression. He talked to me about that, and I told him, no, I'm not ready for that. And I said, no, check this out. Now he says in the notes, he gave me all the things could happen to that flashes and all these things to my eyes. Now he says, oh, how you say that? Oh yeah, the notes say that I was informed that I had posterior vitreous detachment in both eyes. When did he tell me that?
I have no idea.
No, no. Okay, so based on me using my drops and things, what do I need to do
Watch out.
to, help my eyes, you know?
Okay. So we're gonna need to ramp up the because you're using 3070, right?
Yeah,
How much 3070 do you have left?
I may have another bottle I haven't opened. I have to go check my stash. I have a
Okay.
stash.
Then I want you to ramp it up to 4 times a day, so twice in an hour instead of just twice a day.
Oh,
And
let me say something real quick. I had tried to do it 3 times a day and my eyes got real sensitive when I did that with the
okay,
37.
so I want to see if we can try and ramp you up to twice in an hour in the morning and then once in the evening,
Oh,
and then
okay.
we'll ramp up again after a week or so.
Mhm.
But
Okay.
we'll see because I don't want you to go through sensitivity. And if your eyes are sensitive, then I'd rather you change using the See Clear to doing that a little more intermittent than not using the 3070 4 times a day.
Okay. So right
So
now,
we just have to, we're just gonna have to walk, stair step it up.
yeah. What is this posterior vitreous detachment issue situation? I
So
haven't had any flashes and things like that. I mean, I used to have them, but that was way back when, way back.
yeah, the vitreous is in the back of the eye, in behind next to the retina,
Mhm.
and that vitreous fluid is where the lens of the lens in the eye sits. It sits in the vitreous fluid, and the vitreous can actually detach off the back of the eye, and it's called a PVD. You get like an extreme amount of floaters. You usually have some significant flashing and some pain in the eye when you have a PVD. So if he's saying, like, I don't know if he's saying that at some point in the past you had a PVD that's now healed, or you recently had a PVD that has somehow you don't know about it.
Well, that statement there just made, in his note, it said that the detachment in both eyes, which is long standing. Now, a year ago, when I first, come on board with you, I did have these flashes and all that, before you, and then once I started using the
Yeah,
3070, those, whatever those flashes were, subsided. That was a year ago, and I still have some mild floaters every now and then.
right.
But all that other stuff he was talking about, I have had that issue, but it's been like a year or
Yeah, it's
more.
not something that you're dealing with now.
Right, and every now and then I still have a mild floaters, but that's every now and then.
And the vitreous is, you can have a vitreous tear that's not a complete detachment. But the fact that he said in both eyes, it's like, how do you qualify that in both eyes? But I've not experienced it.
I don't know, but all I know is the things he's asking me to look for with all this activity in the eye. I've been through that. It's been, we're in we're July now. That's
Yes.
almost 18 months ago, roughly.
Yeah.
And now let me see, what else did he say? About these detachments in the eye, which are long standing. This this poses less of a risk for a retinal detachment than an acute posterior vitreous detachment.
So you didn't have a vitreous detachment. You potentially had a vitreous tear. And what he's basically trying to say is you've been notified that you had issues with the vitreous. There's not a current issue, and it doesn't pose a problem with your retina. So your retina is not, at a point where it's going to detach.
yeah,
So really, it's kind of like telling somebody, you used to weigh 400 pounds, but you don't now, and you haven't for a long time. But remember when you did?
yeah, and then he says, from that it talks about, if I experience all these other symptoms, to call the office immediately with the
Yes,
flashes and the sprinkles and all these different things.
right.
To call, I'll say okay. So I'm
And
trying
then,
not to even go there right now at all, because like I said, he slickly in the conversation as we were talking before I got these notes, of course, suggesting that, three things we can do. You can just leave it like this, continue to use your latanoprost in that right eye, which I only use it sometime every now and then. And we can send you to a surgeon or whatever it is, to you know, do a workup for the eye cataract surgery.
mm,
And I immediately stopped him at that point. I said, no, if it's not an emergency, I don't want to do it, right now. I don't want that. And he also, I have hypertension anyway, monitoring me for the grade 1 hypertensive retinopathy, for the narrowing of the
the
narrowing
blood
of
vessels.
whatever, something in my eye that's narrow because of the high blood pressure and like that. But that's managed. I manage that myself with natural stuff. So he couldn't find a reason to do something for that, because I told him no, that's being managed by me. My numbers are really getting much better, and that is not an issue for me. But right
Right.
now, I want to deal with these eye changes and stuff that I'm having now, and see what to do. So now back to you. You said to start the 3070 twice in 1 hour in the
Twice
morning.
in an hour in the morning, and then just one time in the evening. And let's see how your eyes do with that over the next few days, next 2 days, really. And then if you're doing well, then we'll add an additional dose in the evening also and watch it for 3 days. And if your eyes do well, we're going to keep that up for probably 30 days and then bring it back down to 3.
Oh, what is a
Because
refraction? What is a refraction? He says he's recommended me to get a refraction, and I noted in here that they said I had one in 2023. I don't remember. I don't remember. I have to go look back. But he was recommending me to go to an optometrist to do that. Isn't that some kind of
yeah,
eye measurement test?
that's really just, your eyes being 20, 40, 2025, 2015, 2020. So a refractive issue is really just the shape of the eye is actually changing over time.
Yeah, he would send me for something that the insurance doesn't cover because based on what
Well,
I
it's
saw.
just an astigmatism. Your insurance will cover it.
But they also, my prescription should already reflect the stigmatism in it because always that's something that the doctors always talk to me about whether it has changed or not when I go get because I just got
Right, when
these
you go get
glasses that I
glasses.
got last year new that I had to come out of and put these on that are what two years old or something.
Right. Right. So he's basically just going through your he's basically going through your eyes, looking at your eyes, going through your history and repeating what's already known.
But why do I do that? Do I need to? Is that unnecessary? I mean, I don't know. Is it necessary to determine, how my eyes are at this point when right now you're telling me that I have a cataract progression? I need to deal with that situation. What does it matter whether or not my eyes lens are?
Well, and it doesn't matter because he's basically saying the reason that your eyesight went from 2025 to 2040 is because of the progression of the cataract. So if we reverse the progression of the cataract, we automatically reverse the eyesight.
Okay, well, I'm gonna do your method for right now and see how I end up with that protocol. I'll do that. You know.
Okay.
And I'll go and check and make sure I have enough because I had bought,
37.
yeah, I had bought extras at one during one of your sale time periods. I'm gonna see what I have downstairs to do that.
Okay. All right. Excellent.
Mhm.
Um, all right. Samsung SM8326UI. Come back up. I'm sorry. We've been an extended time between us talking. Are you still with me? You're not muted. And I'm just saying the name of your phone that's on the screen because I can't remember your name. I'm so sorry. All right. So
I'm
Yasmin.
here.
Oh, there you are. Okay.
Y-
Yasmin,
Yes.
how are you doing?
I'm okay. I'm sitting here listening.
Do you have some questions?
No, so far, no. I don't have any questions. I'm just kind of listening, absorbing, and taking everything in.
All right, that's perfectly fine, perfectly fine. Coolidge Tisdale. Coolidge, I'm asking you to unmute.
Hello.
Hi, how are you doing?
I will not complain. I was just stopping in because I always like to hear the testimonies about your product because I also have it. And I've noticed that it does work as far as the 3070 and the drops,
Revitalize.
the revitalize.
Okay. Why are you using the products? What's happening with your eyes?
It was light progression of cataracts.
Okay. Okay. And you noticed that your cataracts are less intense Are they going away? Are you getting better eyesight? What's happening?
Oh, they've gone away. I
They've
mean, well,
gone.
it's one still just a little, just a tiny bit, but they've gone away. Yeah,
Oh,
I mean,
fabulous.
just to see what it looks like. I mean, my vision is like clear, clear, clear.
Wow,
But
that's awesome.
that's the I don't understand. It works like I mean, it's enhanced like the in the morning, everything is clear and it's more, it's just clear. It's sharper.
Excellent. Excellent.
Yeah,
And what about colors? Have you noticed any difference in colors?
they are. It's just a richer color. It just green is green. I mean, it's greening and blue is blue. Yeah,
That's fabulous. That's fabulous. It sounds like you're having a really good experience, which is wonderful.
yeah.
How long have you been using the 3070?
Let's see. I think it's been at least 9 months now.
Okay. Excellent. Excellent. And you
Yeah,
know,
because
I
I was
go ahead.
no, I was kind of hesitant because I had had retina surgery before, and I didn't know if that would be something that would cause an issue or a problem. Years ago, I mean, it happened like in '83, a long time ago,
Okay.
and it didn't.
Yeah,
It
no,
didn't.
it shouldn't cause any issue at all.
Yeah,
So it's nice to know that you had that experience. You haven't had any issue after retinal surgery, and you're seeing really good in both eyes. It's not just one eye over the other.
right.
That's excellent. That's excellent. So you can be my hype man.
Really? Absolutely. He sounds great.
No, that's absolutely fantastic, and that's the whole point of these products is to bring about better eyesight, without a doubt. So I'm really
Yeah,
excited that you're having that experience. How many times a day are you using the drops now?
I was using them at least one, two. I was doing it 3 times a day.
Are you
I
still on
started doing.
3 times a day?
No, I do it maybe once, twice, and then because like to like today I left home and I always like to have my revitalized, but I always like to keep me one with me, and I left it because I said, well, I'm going out Wednesday. I'll be home, over the weekend, so I'll just have it back because I've noticed the dry eyes. It's not as severe as it was before. It's more normalized now.
Right, right. And okay, that's absolutely fabulous. And you're a truck driver, right?
Correct.
Okay. So yeah, your eyesight matters.
Yeah. So you remember all these things, huh?
Well, I try.
Oh my goodness. Yeah, that's amazing.
Um, and have you had your annual exam? Your
Yeah,
annual eye?
I got my it was 2025 and 2020 binocular because I think the right eye was just five, but binocular is 2020. So
That's excellent.
hmm
That's excellent. So we all should
yeah,
feel safer on the roads.
yeah. Yeah, because but I do it I do the drops in conjunction because I do take lutein and zenazanth and
Yes.
eyebright and stuff like that. So so I guess it all works.
No, and that's a significant thing. You know,
Yeah,
if you're
but the revitalize really help with the dry eyes because you
yeah,
know
the revitalize is kind of a game changer when you're talking about dry eye. So I'm really excited for you. And you actually could probably drop down to a once a day or once every other day protocol and still
hmm
have the same level of vision that you have right now. If you do that, whenever you drop down, you just want to assess, is my eyesight staying where I love it, or is it getting just a little bit worse? And if it's getting a little bit worse, bump it up a little bit. If you're doing it once a day, you might need to bump it back up to twice a day. If you're doing it once every other day. You might need to do it once a day. You know what I mean? You just play with it, and then you'll figure out what your eyes need to maintain this level of sight.
Right. Exactly.
There you go. There you go. Go ahead.
Thank you. I just
No,
want to say
thank
thank you.
you. I appreciate you coming in and let me know. You know, it's good, it's good, it's good. That's a bonus moment.
Yeah.
Okay.
You want to me now? You want to talk to me now, Leslie?
Yes, I do. I do. Thank you, thank you, thank you for coming back. Yes.
Okay. Um, I spoke with you last year about my eyes,
Yes.
and I tell you that I did 7 operations,
Yes.
and I did I think I did 2 operations about 15 years ago to address the same problem. However, I used the eye drops once in last year August, and I was to order over again, but I just get them today because
Okay.
of my financial status. Why I didn't order before.
Right.
However, I order and I receive them today. But what I want to say to you is that I don't know how to use the product. Except I remember from the last time you said use the use the revitalize about 3 days, and then I can start the 30/70 afterward. Now that I have the C-clear added to the protocol, I wanted to explain to me exactly how to use it, because if it text me, I can't read the text. I was so glad when she text me last 2 answers and she put it on microphone. I appreciate that so much.
You're
Oh
welcome,
no.
JJ.
Yes.
Coco knows how to handle it without a doubt.
And it's the first I know of. It's the first I know of those things. The first. I don't know how I get in the program because I've never done it.
Okay. So the first bottle that you're going to use is the Revitalize, and that's the smaller bottle. That's the 1 ounce bottle.
Yes.
Okay. And then the
For how
second
long?
bottle,
For how long?
you're going to do 1 drop, and we're going to start with 4 times a day. So 2 times
Okay.
in an hour.
Four times a day. I'm gonna do
Yes.
it.
Twice in an hour. So you know,
Yes.
your first drop, then you're going to wait 30 minutes and do another drop.
4 times a day.
Correct.
Yeah, understood. That is the revitalize.
So you're going to use all these drops together, but we're just going to talk about each one at a time.
All right, let me ask a question.
Sure.
Am I going to use all drops starting immediately?
You're going to use them in progression, one right after the other. As soon as your eyes normalize and you can
Yes.
blink and look around, you're ready for the next drop.
All right, let me ask another question. When I used the drops last year, August, you told me I should use the revitalize about 3 days in
Yes.
succession.
Yes. And I was gonna talk about that last instead of first, because you are gonna need to, because you've had a period of time where you haven't used Revitalize, you are gonna have to get your eyes rehydrated.
And that's what I'm doing.
Okay, so are you using Revitalize now?
I get it today.
Okay, so what you want to do is you want to use the Revitalize 6 times in an hour. So every 10 minutes for an hour in the evening and in the morning for 3
How many
days.
times per day?
So you want to do 6 times, 6 doses. So 1 drop every 10 minutes for an hour. One
Yes.
hour in the morning and 1 hour in the evening.
Understood.
Okay. Yeah. So if you were to start tonight, you're going to use the Revitalize every 10 minutes for an hour, 1 drop.
Yes. Understood.
Okay. You're going to do that for a period of 3 days. And after
Understood.
3 days, you're still going to use the Revitalize, but then you're going to add the other drops.
Understood.
Okay. And
Oh,
what
let
other,
me ask a question there. Do
yeah,
I incorporate both the Vitalize and the C Clear together?
yeah, you're going to use the Revitalize. Then you have the 3070, right?
Yes.
So Revitalize, 3070, and then the C Clear. That's the order. Revitalize, 3070, and then the C Clear.
Okay, let me ask a question again.
Yes.
What is the space of time? I put in the Revitalize first, I wait how many minutes?
You're not going to wait minutes. You're just going to wait till your eyes are ready for the next drop.
Okay, then I put in the 3070.
Correct. And
And
then
then
you're
I
going
put
to,
the C Clear.
and then, yeah, as soon as your eyes are normalized, you're going to then add the C Clear.
All right.
And then you're going to,
How many times within an hour? How many times within an hour?
so you're going to do the first set of doses, the first 3, and then you're going to wait 30 minutes and you're going to repeat it.
For how many times within an hour?
So twice within the hour.
Okay, very good, very good. So on the 4th day, I take all 3, but I use them half an hour apart. Two
Correct.
times, two times per
Times,
day.
2 times per day. That's correct.
Okay, understood. Um, maybe it's too early to tell you this, but I can tell you the experience I have. I use over the counter eye drops. But I didn't use it in my eye yesterday because it was finished. So this one came here just right in time. Um, don't laugh, don't laugh.
That's
This,
Oh
this,
no,
awesome.
this,
that's how it works. Right on time.
right. But I put it in my eye, but my eye didn't feel anyway funny today. Like the first time it used to sting me a lot. I had issue in my eyes settling down the first time I used it last
Wow.
year. But this year, when I put it in, I don't have any problem.
That's excellent.
Okay. So, is there any need for me to use my other eye drops in my eyes?
No, there's no need for you to use those other eye drops if you don't want to. If you want to, you can use them. But if
No
you don't,
problem.
if you don't want to, you don't have to.
Quite.
They're not going to bring any benefit that you're not already getting.
Okay. Very, 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 very understand clearly. And presently, about a month ago, I've been taking lutein and zeaxanthin.
Yes.
I've been taking that.
And both lutein and zeaxanthin then are in the C Clear with DMSO. So
Understood. I understood.
that's part of that eye drop. So you taking it is just helping the eye system along. So there's no harm.
Okay.
That's fantastic.
Understood. And one more question.
Yes.
Um, I don't see out of my right eye
Yet.
yet, but
Yes.
it has improved slowly, progressively. Because before then, about 2, 3 years ago, after I did the operation, I wasn't seeing out of my eyes. But now I can see little things out of that eye. So I'm hoping that by taking care of the eyes presently now, um I'm looking forward to have improvement, no matter how small. I'm looking forward to have improvement by
Excellent. Excellent.
by using the eye drop. My left eye now, it is not excellent also. It is not excellent. But when I did the operation on the first eye, listen keenly, Leslie, listen keenly. They put in the lens in my eyes, but because my eyes was bathing so badly, they had was to take the lens out of it. So my right eye does not have any lens.
Doesn't have any lens. Yeah. Yeah.
So what is that what is the repercussion of that?
So you're just never going to have quality sight in that eye.
Very good, very good,
So
very good and straightforward. Should I replace the lens in the eye?
has your doctor said that's possible?
He, because the reason why he didn't put it back in the eye is because the eye had so many scar tissues.
Right.
So why I'm asking you this question, if after using the product, the scar tissues has improved a lot, is it advisable for me to replace the lens in the eyes?
So I would absolutely go to the doctor and say, look, I want you to take a look at the eye and the scar tissue and let me know if you believe that it's possible and that the surgery would be successful.
Praise the Lord. That sounds reasonable.
Yeah.
Okay.
And
Okay, that's
that terminology, when they leave the eye with no lens, it's called aphakia. So it's APHAKIA, aphakia.
apicare. And,
Yeah.
and the doctor told me, if I asked him, he said I would not be able to see out of that eye.
Yeah, no, and there have been people that have had no lens in their eye and that they get a certain level of sight back. So they can see images, they can't see detail. So you're not going to be able to read with that eye or see a license plate on a car, but you're able to like see color and you can identify um
Images.
buildings and things like you may not be able to read the word Wendy's on the sign, but you can tell that that's a Wendy's. You know enough about the building setup to say, okay, I know what that is, even though you can't actually see the detail of it. But you can get enough vision that you can see enough of what's going on that you can tell, oh, that's a brown dog as opposed to that's some kind of animal. It could be a dog, a cow, a horse. I have no idea. You know what I mean? You'll be able
Yeah.
to get a certain level of acuity um, using castor oil and DMSO, but you're never going to have the kind of acuity that you would have if you had a lens in the eye.
Okay. So therefore, just thinking, if after using the product and the eye get better to a certain level, I can consider discussing with my doctor, and if
Yes,
he's
I would actually go see your doctor after about 2 months of using 3070 again. After the first couple of months, you'll be about halfway through the bottle. That's the time that I would go see the doctor and say, I want you to take a look at the eye and the scar tissue and let me know if there's been enough repair of the scar tissue that, inserting a lens would be viable. And he's going to be able to tell you either right there, like right now, it's good enough that we could do it, or you're well on your way.
okay, very good. And one more question, Leslie.
Sure.
The other left eye now. Oh God, I missed my chain of thought. Oh yes, it's having the lens. Is it okay for the drops to go in it?
Yes, absolutely. 100%.
Okay.
So
Well, I see.
I just
Well,
wanted to say this, those interocular lenses, those replacement lenses are made from a type of silicone that doesn't interact with DMSO or castor oil. So anybody that's had cataract surgery and has replacement IOLs, and that stands for interocular lens, they will not interact with the DMSO and castor oil, and DMSO and castor oil won't disrupt them in the eye in any way, shape, or form.
okay. And just to revise now, my eye drops is 2 times a day after 3 days. Two
Correct.
times, 2 times a day after 3 days. But
Correct. So
presently, 3 times, 6 times, 2 times a day. Presently,
correct.
okay,
Six times
Leslie.
an hour twice a day.
Yes, thank you very much for 3 days, and
Correct.
then I start all three, and I do it. I do it all three, all three, all three twice drops in an hour.
Right. Twice in an hour, morning and evening.
Thank you very much. Understood.
Excellent.
You're
And
you're doing a great job.
tell me your name again. Please tell me your name.
Okay, my daughter made the order. She's Zalika Sterling, but my name is Joan Sterling.
Okay, Joan. Am I correct? Did I hear you correctly, Joan?
Yes, Joan.
All right, great. Thank you so much. Because now, whenever you come up, because it has your phone ID, I'll know it's you, and then I won't be calling you Samsung.
Okay, okay. So yeah, you have my number, but you told me you'd have text me on WhatsApp the information, but I look on WhatsApp, but I don't see the information.
So, okay, I didn't send it to you on WhatsApp.
No, no, because I type in bear cat body on my WhatsApp and it didn't come up.
Really? I don't know if it'll
Ye-
come up with Bearcat Body. Um,
What what it will come up with?
so I think you have to put in my phone number, but
Okay, okay.
do you have the
Well,
ability to take down my phone number that's on WhatsApp?
I won't be able to see it, but if I write it, I can squeeze and squeeze until I make it out. If I write it, I will may able to take it off. So let me write it now. Let's repeat it
Okay.
for me. Yes, let me write it
Let,
now.
let me know when you're ready. Are you ready?
I am ready.
Okay, it's 727
7, 2, 7.
415.
Just a moment.
Okay.
415. I want to be paid hurricane. 415. Yes.
4133.
4, 1, 3, 3.
Right.
Okay, I try to write it down, and I write it very big. When the day get brighter like tomorrow, I'll try to rewrite it in the phone.
Okay, no
But
problem.
right now, because it's night, I'm not able to see it properly.
Yeah, I understand. And yeah, I want you to keep an eye out, be aware of getting more light in your eyes over the next couple of weeks. Because using 3070, you should start to see more light in the bright light as well as in the darkness.
Okay, very, very good, very good. I'm hopeful. I'm hopeful. I don't have any doubt.
Excellent.
Thank you very much, Leslie,
No,
and
you're
thank you
more
for
than welcome.
and
And
thank you on behalf of the other people. Thank you for the good work that you have been doing.
Oh,
May God
thank
and
continue.
you.
May God continue to strengthen you.
and come back anytime. You're allowed to come on this call. It's every Tuesday, Wednesday, and Thursday from 6:30 to 8:30 Eastern. You can come on this call anytime.
Okay, no problem. Thanks for the invitation.
You're more than welcome.
I don't even know how to get up now, but I will stay until it ends. I don't know how
Okay.
to get up.
Well, it's 8:11 and we only have like another 20 minutes. So, you know,
Yes.
just do what you're doing and the call will close. It'll close on its own when I'm, you know.
Okay, okay. So if I want to go back and like say I want to go back on TikTok, what do I do?
If you wanted to go back and what?
On TikTok, what do I do?
So yeah, you have to open the TikTok app and go because
Okay.
you didn't come to this call from TikTok.
No, no, I came. Yeah, yes, I came. Yeah, man, I was typing to you because I was on TikTok So I go in your your box and start to message from your box.
No, it was actually my inbox where I sent the link to you to
Oh,
Zoom. So yes, when the TikTok live starts at 9 o'clock p.m. Eastern time, you can just
Yeah.
go directly into Bearcat Body and
Okay.
yeah, and you'll see the live.
Okay. So you'll be on TikTok then 9 o'clock then.
yes.
No problem.
Yeah,
Okay.
I'm
Thank
on
you very much,
TikTok
Leslie.
from 9 p.m. to 10 p.m.
Nah, thank you very much, Leslie. I'll try and be there.
You are more than welcome.
Okay.
Okay, we still have Yasmin, and I'm not for sure if you spoke to Anne.
Um,
Did you already speak to
no,
Yasmin?
no, I think I spoke to Yasmin, but I haven't spoken to Anne. I spoke to Anne Katan, but
Right.
not Anne.
Okay. So Anne, if you want to unmute your mic, if you had a question.
Coco, have you checked YouTube to see if there's any questions?
I have not. I was driving. Give me 1 second.
No. You don't have to. No, I just wanted to know. You don't have to do anything.
Oh no, I'm stationary now.
Oh, okay. Yeah, Audrey White, 1020 says, even my glaucoma medicine stings, dorzolamide. Yeah, no. And the reality is, there's nothing that you're going to put in your eye that's not going to sting. Even water can have a little sting to it. Um,
Excuse
but
me, Leslie. Excuse me, Leslie.
yes.
I forget to ask you. Should I put the product in the fridge?
So only if the temperature in your house is warmer than 80 degrees.
When I'm in Jamaica, we always have a warm. So
Okay,
always have
then
a,
I would absolutely put it in the fridge.
with all three of them.
All three of them.
Okay, I put them in tomorrow.
Okay, excellent.
Okay, no problem.
Yeah, that's
Okay,
why
so
that's why that refrigerator is on there for my customers in Jamaica and in Trinidad and Tobago and
hmm
the DR and like yeah, you can't just even if you have AC, you can't just leave them out because it gets so hot so quick.
right. And Audrey White 1020, she stated my vision was 20/30 in my left eye before cataract surgery. After surgery, it was worse, was 20/40.
Ooh, that's not good. How long ago, Audrey, if you're listening, how long ago did you have that surgery? And has it gotten any worse, since you got the 2040 measurement? It's surprising how many people wind up with worse eyesight after cataract surgery than they had before cataract surgery.
Right.
And even if people have worse eyesight, because they didn't lose their eyesight completely, it's considered, a good surgery. Like the surgery was successful.
Right,
Got it.
especially because it
Gotcha.
didn't happen within 30 days, you know, like we
Yeah.
were talking about.
Yeah, and they typically only measure for 30 days. So as long as if you lose your eyesight completely on day 31, you still had a successful surgery.
Yep. Kind of like almost like blaming the victim in a way. They'll blame you for your fault, not
No, that they absolutely do. They absolutely do. So their whole mode of operation is, what did you do?
right.
Did you pick up something heavy? Did you take a shower with hot water? Did you walk around?
Right.
Leslie, may I ask a question?
Of course.
Should I start using the elixir away from the other stuff?
The luster elixir?
Yes.
Not until we know how foreign eye is reacting in your eye, foreign eye 2.
Okay.
So I just want to really focus on the one thing at a time with your eyes so I
Mm-hmm.
can really understand what's being effective and what's not being effective in the eye, and then we'll add on. Because I think as far as your cornea is concerned, I think the luster elixir is going to, give you a lot of benefit, but I also think it works fairly quickly. So that colloidal silver is very positive in the eye. And that's why I'm willing to just like, let's hold off just a little bit longer until we
Oh,
know how far IT is working out.
okay, this may be premature, and I may have asked it already, but um, your products does help scar tissue.
Yes,
Okay.
yes, without a doubt. Castor oil is huge for, um, reducing scar tissue, for just dissolving it. And I wish, like, I don't know if everybody can see this scar that I have on my hand. Um, and it's a pretty big scar. And I wish I could show you the picture of the day that I did this. I was making sugar wax, and I was pouring it from the pot into another container, and it boiled over and
Ugh,
caught my hand.
that was
Yeah,
a
it was
burn.
exciting. It was exciting, and it left this scar. But I started using I used DMSO on it when it happened. Like I just poured DMSO on it and
You
let
like
it be.
pain, huh?
I do not like pain.
That
It's not
sounds
like I
so,
seek it out.
it sounds so harsh. Did it hurt?
Yes, it hurt.
Okay, all right.
It hurt like crazy. Um, but as soon as I put the DMSO on it, like it gave that sting, but then it took
Mm-hmm.
all the heat out of the scar, out of the hand. So, and this was all bubbled up. There was this huge bubble
Oh,
in of the skin, and it took all the heat out of it. And within 24 hours, it went completely down flat to skin again.
oh, really?
I
And
believe you have some videos
I
on
do.
your TikTok. Yeah.
Yeah, I do. But I kept using 3070 on it every day. And now, I mean, you can see the scar, but you cannot feel the scar. Like if you were just touching this area, you wouldn't think, oh, there's a scar there because the skin is like perfectly, perfectly perfect. There's no ridges, no edges, no, it doesn't have any kind of raised area in any way, shape, or form. And if I had people saying, you need to go to the hospital. And I'm like, no, I don't. But if I had gone to the hospital, they would have said it's the third degree burn, and I agree it was, but it was not necessary to go to a hospital for treatment. And even if I had with their treatment, I wouldn't have gotten this result from, you know, that big of a burn. And I got to tell you, the castor oil and DMSO have just made this area, the skin, and even the skin underneath, if you push down and rub, on a scar, you can always feel there's deep scar tissue. There's literally nothing.
Mm,
And I'll tell you, on my leg, so at 23, I was in a severe car accident where a semi, we were going slow. So luckily we were not like on the highway. We were on a neighborhood road. But the driver of the semi fell asleep, crossed the lane of traffic, and hit me head on,
mm,
which broke my femur in half.
mm,
So I have a scar from the center of my knee all the way up to my hip,
mm-hmm.
because I had to open my leg up and then, put a plate in and do whatever they do to get the bone strong, strengthened so you can heal.
All right.
And I wish I had known about comfrey at that point because I would have just stayed in the hospital and used comfrey and let that
Oh, my
heal.
girlfriend, that's what she lives with, comfrey.
Yeah. But where was I going? Oh, so the scar on my leg has been raised for I'm 50, well, I'm 62 right now. So probably until like 56, 57. Like you could rub that scar and you could feel it all the way up my leg. You could feel the raised area of the scar. And I started using DMSO and castor oil on it. When I started making the pain-free body butter for my mom, I just started putting it on that scar. That scar is flat as any surface of skin on my body at this point.
That's excellent. Oh,
So
that's
years, like
amazing.
decades later, it's,
That's
yeah, it feels absolutely fabulous, and you would never know, other than looking at it, because you can still see it, but even looking at it, it's not as present as it once was. So because the skin's not mad anymore.
so it helped with the appearance and the feel, huh?
Yes. Yeah.
I think they call it K-light or something like that. When you get
Keloid
a,
is the big raised.
yes,
Yeah,
when
yeah.
the screen raise up.
Yeah.
Leslie, let me ask you one question. You
Sure.
sent you sent a, I can barely make it up, but it's a water solution, something like that.
Yeah. I think that's called O water. I sent you the O water. And that's just to help hydrate the eyes also.
Okay, so
So
it came in my package. It's a gift.
it's a gift, yes.
Okay, so how do I use that gift?
So you're just going to drop that in the eye any time of the day, anytime you feel like you got a little dry eye, or if any of the other drops are giving you a little too much of a sting, you just drop that O water. It's oxygen water saline solution.
Okay, okay. Thank you very much. I just remember that I saw it in my package.
Yes. So that's what that is. Yeah, and that was just a free gift for you to use whenever you feel like you need it.
Okay, thank you very much. I understood.
You're welcome. You're welcome.
Leslie, what was your expectation with the comfrey at that time?
Well, because comfrey is known to actually repair bone. So if I would have known about comfrey, I would not have had the surgery. I would have opted for them to set my leg and then just use comfrey to get the bone to reconnect.
When you
Oh,
say comfrey is a plant referring to Leslie?
Yes,
yeah.
ma'am. Yes.
Mm-hmm.
I have a lump on my foot. A bump go out on my foot. Could I put the comfrey on it?
Yeah, you can also put the 30/70 on it.
Okay, so
So just put a couple of
I would,
drops of 30/70, rub it
yes.
on there, and if you have access to comfrey, put the comfrey on it, put a sock on it, and let it do its job. So you,
It's the first time hearing that. It's the first because we have comfrey in Jamaica.
yes, exactly.
Okay,
Exactly.
okay. So I
My
just crush it up. I just crush it and put it on it. Just crush it and put it on it.
You don't even need to crush it up. You could just
yeah,
take a piece of the leaf,
yeah,
put it on
yeah.
that bump, and then put a sock on and just, let it hang out.
Them call those bump them call it like lupoma. Can you pronounce it for me? Lupoma.
So do you have a lipoma?
Yeah, it's something like that. Like, it's one in the family. Like little lumps come out at different parts of your body.
Okay, that's probably not a lipoma though, because a lipoma actually cells coagulate and they grow underneath the skin.
It is not anything because I did a X-ray on it and they say it is no it is not harmful.
Okay, so yeah, if it's benign, honestly, I would be putting the 30/70, just put a couple of drops on your finger, rub it on that area, put the comfrey leaf on, put a sock on, and let those natural things take care of it.
Okay, thank you very much, Leslie. I'll do that.
You're welcome. You're more than welcome.
Okay.
Moses, I've never heard of a
Coco, is that you talking? Because you're breaking up.
No, that's
Oh, I'm
not.
sorry. That was me. Can you hear me now?
Okay, Altamise, yeah.
I was just saying my girlfriend used comfrey for everything, but I don't think she knows anything about it healing bones.
Yeah. Yeah, no, it's well documented, that
Mm,
comfrey is significant in healing bone,
I didn't.
especially if you're going to just set the bone and you're not doing any kind of surgery and the bone is properly set, it will fuse faster and more secure
Get
with comfrey
out.
than without.
God made it all, right?
Say anything truer than that.
Whew. Mm.
We're
If you
down
can
to two
find
minutes.
something, say it, say it, say it. I'm actually going to do a post tomorrow because I was having this thought this afternoon. Um, Lily and I were in the office and I was making C clear with DMSO. And the thought came to me, Henry Ford said, whether you think you can or you think you can't, you're right. And the thought came to me, you know, people are told consistently that you're going to go blind or that you're never going to be able to recover your sight or this is the best eyesight you're going to get. And if you believe it or you
Right.
don't believe it, then
That's
it's
what comes
true
true, huh?
either way.
Yep,
Exactly. It's
yep,
true
yep,
either way. So
yep.
if you do believe it, why would you choose that? Because that's really the outcome. The outcome is what you choose to
But
believe.
you, mm-hmm, mm-hmm.
So, and Altamise with your eye issues and like Devora with her eye issues, the issue is not, well, this didn't work. Sorry, good luck. It's let's figure it out. What else are we doing? We got time.
Yeah, yeah, because I know it's going to work. It's just
Right. We just
what
have to
path
figure
we're
out
taking.
what's that sweet spot. I almost liken it to, back in the back in the day in the 50s and 60s, they'd always have, somebody cracking a safe with their ear up against the safe and then just turning it a little bit at a time, trying to get, everything to fall the right way so they could unlock the safe. I really feel like this is what that is let's just keep tweaking the process until we find what's your sweet spot.
And then we can just go gong ho once we
A
find
hundred
that.
percent, hundred
Yeah,
percent. Then you're, the great thing about sledding is the downhill. It's not dragging the sled up the hill.
really. Yeah. Oh, yep, yep, yep.
Alrighty. I don't see where Ann came back in, so it is actually 8:30 p.m. Eastern time.
Oh, it's that
It
time.
is that time.
It is that time. Well, everybody, thank you so much for hanging out with us this evening. It's Wednesday, July 1st. I want you to know there's a 30% off sale on the site. The whole entire site is on sale, 30% off. And we have free shipping from July 1st, midnight July 1st until midnight July 4th is the course of the sale. So feel free to go and explore and purchase. Do that.
Thank
And
you, thank you, thank you.
And then come on these lives and ask questions and,
Leslie, one more
come on
question,
this
Leslie.
community.
One more
and
question. How do I
Sure.
get on? How do I get on the next time you come on? You're coming on live. How do I get on?
So you
You
can
want,
still,
it's the same link that I sent you in the
Okay.
DM.
Thank
Yeah,
you
yeah,
very much.
you can always
no
go back
problem.
to that same link and it's going to be the
Okay.
same link every time.
Thank you very much. Understood.
Excellent.
Uh,
Okay, so visit me at bearcatbody.com. Thank you so much for hanging out, everybody. Have a wonderful, blessed evening. And remember, we fight for your sight. Take the best care, nurture yourselves naturally. I love you guys.
love you,
love you
thank
back.
you.
You.